Nutraceutical supplements, beneficial for those prescribed. Psychostimulants. Please identify the top 5 or 6 nutraceuticals for supplements that offer substantial benefits for adult patients prescribed psychostimulants, such as methylphenidate. For each supplement, include a concise yet informative overview of its physiological advantages and how it contributes to enhancing overall health and cognitive function in these individuals. Below is an overview of 6 nutraceuticals for supplements that have been found to offer meaningful benefits for adults prescribed psychostimulants like methylphenidate. These compounds support cognitive function, mood regulation, and overall brain health, which may help mitigate some of the challenges associated with long-term stimulant use. 1. Omega-3 fatty acids overview. Omega-3 fatty acids, particularly EPA and DHA, are critical for maintaining neuronal membrane integrity and reducing inflammation. They support synaptic plasticity and have been linked to improved mood and cognitive performance, which can complement the effects of psychostimulants. 2. Magnesium overview. Magnesium is involved in over 300 enzymatic reactions, including those that regulate neurotransmitter release and neuronal excitability. It may help alleviate common stimulant-related side effects, such as irritability, insomnia, and muscle tension, while promoting relaxation and improved sleep quality. 3. Zinc overview. Zinc plays a key role in the synthesis and modulation of dopamine, a neurotransmitter targeted by psychostimulants. Adequate zinc levels can enhance neurotransmitter regulation, potentially improving attention and cognitive function, which is particularly beneficial for patients on stimulant therapy. 4. Vitamin B complex overview. B vitamins, especially B6, B9, and B12, are essential for energy metabolism and the synthesis of neurotransmitters. They help maintain optimal brain function, reduce fatigue, and support stress response systems. This nutrient support is crucial for balancing the high energy demands of psychostimulant treatment. 5. L-theanine overview. Found primarily in green tea, L-theanine is known for promoting relaxation without sedation. It can help smooth out the peaks of psychostimulant action by enhancing alpha brainwave activity, thereby supporting improved focus and reduced anxiety, a balance that aids in better cognitive performance. 6. N-acetyl L-cysteine, NAC, overview. NAC acts as a precursor to glutathione, one of the body's most potent antioxidants. By reducing oxidative stress and supporting detoxification pathways, NAC offers neuroprotective benefits. This can help maintain overall cognitive health and may mitigate potential neurotoxic effects associated with long-term stimulant use. Each of these supplements contributes a distinct physiological advantage, whether by modulating neurotransmitter synthesis, reducing oxidative stress, or supporting overall neural health. Integrating them may enhance cognitive function and overall well-being in adults taking psychostimulants. However, individual needs vary, so professional guidance is key when incorporating these into a regimen. GQ asked, also list another 4 to make it 10 in total. Expanding upon the previously discussed nutraceuticals, here are 4 additional supplements that may offer substantial benefits for adults prescribed psychostimulants like methylphenidate. 7. Cytocline, CDP-choline, overview. Cytocline is a compound that serves as a precursor for the synthesis of phosphatidylcholine, a major component of neuronal membranes. It supports brain energy metabolism and enhances neurotransmitter production, particularly acetylcholine and dopamine, which are crucial for cognitive functions such as memory and attention. Supplementing with cytocline may improve focus and mental processing speeds, complementing the effects of psychostimulants. 8. Phosphatidin overview. Phosphatidin is a phospholipid that is integral to cell membrane structure and function, especially in brain cells. It plays a role in cell signaling and apoptosis regulation. Supplementation with phosphatidin has been associated with improved cognitive functions, including memory and processing speed, which can be beneficial for individuals on stimulant medications. 9. Bacopa monnieri overview. Bacopa monnieri is an herb traditionally used in Ayurvedic medicine for its cognitive enhancing properties. It contains active compounds called bacosides, which are believed to improve memory, focus, and mental flexibility by enhancing nerve impulse transmission and exerting antioxidant effects. Bacopa may also have adaptogenic properties, helping the body manage stress, which can be advantageous for individuals on psychostimulants. Nipost.comipost.com. 10. L-tyrosine overview. L-tyrosine is an amino acid that serves as a precursor to neurotransmitters such as dopamine and norepinephrine, which are involved in mood regulation and cognitive functions. Supplementing with L-tyrosine may enhance cognitive performance, particularly under stress, and support the neurotransmitter systems targeted by psychostimulant medications. Verywellhealth.com. Integrating these supplements into the regimen of adults taking psychostimulants may provide additional support for cognitive function and overall brain health. However, individual responses can vary, so it's advisable to consult with a healthcare provider before adding new supplements to ensure safety and efficacy. GQ asked, is the list ranked in terms of importance? The previous list of supplements was not ranked in order of importance. Determining the most beneficial supplements for individuals prescribed psychostimulants like methylphenidate depends on various factors, including individual health profiles, specific nutritional deficiencies, and personal responses. GQ asked, okay, recreate the list ranked by importance. We can assume an average 45-year-old in perfect health. Below is a ranked list of 10 nutraceuticals, the supplements prioritized for an average 45-year-old in perfect health prescribed psychostimulants, such as methylphenidate. This ranking reflects the overall evidence supporting cognitive enhancement, neurotransmitter regulation, neuroprotection, and stress modulation, all key areas for optimizing brain function in individuals on these medications. 1. Omega-3 fatty acids overview. Omega-3 fatty acids, EPA, and DHA, are foundational for brain health. They enhance neuronal membrane fluidity, reduce inflammation, and support synaptic plasticity, all of which contribute to improved mood, attention, and cognitive performance. 2. Vitamin B complex overview. B vitamins, especially B6, B9, and B12, are essential for energy metabolism and the synthesis of neurotransmitters. Their support of brain function and stress response is crucial for sustaining the high cognitive demands associated with psychostimulant therapy. 3. Magnesium overview. Magnesium is integral to over 300 enzymatic reactions, including those that regulate neuronal excitability and muscle relaxation. It helps counteract potential stimulant-induced side effects such as irritability and insomnia, promoting overall calm and sleep quality. 4. Citicoline, CDP-choline, overview. Citicoline acts as a precursor to phosphatidylin and acetylcholine, boosting cognitive processes like attention, memory, and processing speed. It supports neuronal membrane integrity and enhances overall brain energy metabolism. 5. Zinc overview. Zinc is pivotal for dopamine synthesis and regulation, directly influencing attention and executive function. Its role in neurotransmitter modulation makes it particularly beneficial for patients on stimulants who rely on balanced dopamine signaling. 6. N-acetyl L-cysteine, NAC, overview. NAC boosts glutathione production, the body's primary antioxidant, thereby reducing oxidative stress. This neuroprotective effect can help maintain cognitive function and mitigate long-term cellular stress associated with stimulant use. 7. L-theanine overview. L-theanine promotes relaxation and mitigates anxiety without causing sedation. By enhancing alpha brainwave activity, it smooths out the peaks of stimulant action, resulting in improved focus and a more balanced mental state. 8. Phosphatidylin overview. As a critical component of neuronal membranes, phosphatidylin supports cell signaling and cognitive processes, such as memory and concentration. It helps maintain the structural integrity of brain cells, promoting long-term cognitive health. 9. Bacopa monnieri overview. Bacopa monnieri is an adaptogenic herb known for its cognitive-enhancing properties. It improves memory, learning, and stress resilience by modulating neurotransmitter activity and reducing oxidative damage. 10. L-tyrosine overview. L-tyrosine serves as a precursor to key catecholamines such as dopamine and norepinephrine. While beneficial for neurotransmitter synthesis, its impact may be less critical when dietary protein is sufficient, making it a lower priority compared to the other supplements on this list. Each supplement offers distinct benefits that can complement the effects of psychostimulants. However, the ideal combination and dosing should be tailored to the individual, so professional guidance is recommended. GQ asked, "Thank you. Magnesium would be good for methylphenidate-induced cramping, wouldn't it?" Yes, magnesium would be highly beneficial for addressing methylphenidate-induced cramping. Magnesium plays a crucial role in muscle relaxation and preventing involuntary muscle contractions by regulating calcium influx in muscle cells. Since psychostimulants, like methylphenidate, can increase muscle tension and sometimes lead to cramping due to heightened sympathetic nervous system activity, magnesium helps counteract this by reducing muscle hyperexcitability. Magnesium competes with calcium at the neuromuscular junction, preventing excessive muscle contractions that can lead to cramps, balancing neurotransmitter activity. It modulates glutamate and GABA activity, promoting relaxation and reducing stimulant-induced tension, supporting electrolyte balance. Magnesium works alongside potassium and sodium to maintain proper nerve signaling and muscle function. For best results, magnesium glycinate or magnesium citrate are preferred forms, as they have better bioavailability and are less likely to cause gastrointestinal discomfort compared to magnesium oxide. Would you like recommendations on optimal dosage or timing for magnesium supplementation? GQ asked, "Can you explain to me why you ranked omega-3 fatty acids above B-complex and magnesium?" Omega-3 fatty acids earn the top ranking because they lay the foundational groundwork for overall brain health, which is crucial for anyone on psychostimulants. Here's the reasoning behind their higher placement compared to B-complex and magnesium. Neuronal membrane integrity. Omega-3 fatty acids, especially DHA, are vital components of neuronal cell membranes. They help maintain the fluidity and structure necessary for effective signal transmission across neurons, which is a core aspect of cognitive function, anti-inflammatory, and neuroprotective effects. These fatty acids have potent anti-inflammatory properties that protect brain cells from chronic low-level inflammation, a risk factor that could be exacerbated by long-term psychostimulant use. This broad neuroprotective area supports sustained brain health, enhanced synaptic plasticity. Omega-3s promote synaptic plasticity, which is essential for learning, memory, and overall cognitive adaptability. This makes them especially valuable for maintaining cognitive resilience over time. In contrast, B-complex vitamins primarily facilitate energy metabolism and neurotransmitter synthesis. They support the brain's functions, but are more focused on ensuring the energy and chemical signaling systems run smoothly rather than directly bolstering the structural aspects of brain cells. Magnesium is crucial for muscle relaxation and modulating neural excitability, which is particularly important for mitigating specific side effects like muscle cramping. Its benefits, while significant, are more targeted toward managing the side effects of stimulant use rather than providing the broad, systemic support offered by omega-3 fatty acids. In summary, omega-3 fatty acids are ranked highest because of their comprehensive benefits for neuronal structure, inflammation reduction, and synaptic function, key factors that underpin overall cognitive health. GQ asked, "I have the following supplements available to me. Which ones would be a priority to take in this case? Magnesium glycinate, zinc glycinate, vitamin D3 5000 IU, vitamin K2, N-acetyl cysteine, berberine omega-3 fish oil, chromium picolinate, glucosamine sulfate, L-glutamine powder." Please remember this is to benefit an individual that also supplements with prescribed methylphenidate HCl in the form of Concerta. 2 halves. Based on the supplements you have available and the goal of supporting cognitive function and minimizing potential side effects of Concerta, methylphenidate, here's a prioritized list with explanations. 1. Omega-3 fish oil. Why? Omega-3s, EPA, and DHA are foundational for brain health. They enhance neuronal membrane fluidity, reduce inflammation, and support synaptic plasticity, all critical for optimal cognitive performance and neuroprotection when using psychostimulants. 2. Magnesium glycinate. Why? Magnesium plays a key role in muscle relaxation and neuromuscular function. It can help mitigate methylphenidate-induced muscle cramping and tension, while also supporting overall neural health by modulating neurotransmitter activity. 3. Zinc glycinate. Why? Zinc is essential for proper dopamine synthesis and regulation. For someone on methylphenidate, which targets dopaminergic pathways, maintaining adequate zinc levels can support mood, attention, and cognitive function. 4. N-acetyl cysteine, NAC. Why? NAC boosts glutathione production, the body's main antioxidant, which helps counteract oxidative stress. This neuroprotective effect is particularly valuable in offsetting any long-term cellular stress that might arise from psychostimulant use. 5. Vitamin D3, 5000 IU, plus vitamin K2Y. While not as directly linked to neurotransmission as the top 4, vitamin D3, especially when paired with K2, supports overall health, immune function, and may contribute to brain health. Given that vitamin D deficiency is common, ensuring optimal levels can have broad systemic benefits. The remaining supplements, berberine, likely berberine, chromium picolinate, glucosamine sulfate, and L-glutamine powder, are more targeted toward metabolic support, joint health, or gut function. They aren't as directly linked to mitigating the specific neuromuscular or cognitive concerns associated with methylphenidate use. However, if you have additional health considerations, like metabolic regulation or joint support, these may be incorporated as secondary priorities. GQ asked, Q1, how do omega-3 fatty acids specifically support synaptic plasticity and cognitive resiliency in those taking psychostimulants? Omega-3 fatty acids, particularly DHA and EPA, are integral to neuronal membrane composition. By incorporating into cell membranes, they enhance membrane fluidity and receptor function, which in turn facilitates efficient neurotransmission and synaptic remodeling. This improved synaptic plasticity is vital for learning and memory. Additionally, their anti-inflammatory properties help protect neural tissues from the oxidative stress and inflammation that may be elevated during psychostimulant use, thereby contributing to long-term cognitive resilience. Q2. What mechanisms allow magnesium glycinate to alleviate muscle cramping associated with stimulant use? Magnesium glycinate is a highly bioavailable form of magnesium that aids in muscle relaxation and neuromuscular regulation. It competes with calcium at the neuromuscular junction, which helps prevent excessive muscle contraction that can lead to cramping. Moreover, magnesium stabilizes nerve impulses and supports normal muscle function, reducing the likelihood of spasms and cramping often observed with stimulant-induced increased muscle tension. Q3. In what ways does zinc glycinate enhance dopamine regulation and cognitive function for individuals on Concerta? Zinc is a crucial cofactor for several enzymes involved in dopamine synthesis and metabolism. By ensuring optimal dopamine production and receptor modulation, zinc glycinate supports the neurotransmitter pathways that are central to the therapeutic effects of Concerta. This not only enhances attention and mood regulation, but also improves overall cognitive performance. The glycinate form is particularly effective because it is more readily absorbed, ensuring that the body maintains sufficient zinc levels for these processes. Q4. Could you detail how NAC's antioxidant properties contribute to neuroprotection in the context of psychostimulant therapy? N-acetylcysteine, NAC, serves as a precursor to glutathione, one of the body's most potent antioxidants. By replenishing glutathione levels, NAC helps neutralize free radicals and reduce the oxidative stress, a factor that can be exacerbated by prolonged psychostimulant use. This reduction in oxidative damage protects neuronal cells and supports mitochondrial function, thereby preserving overall brain health. Additionally, NAC's ability to modulate glutamate transmission further contributes to its neuroprotective effects, making it a valuable adjunct in psychostimulant therapy. Q5. How might the combined effects of vitamin D3 and K2 support overall systemic and brain health, especially when using stimulant medications? Vitamin D3 plays a key role in immune modulation, anti-inflammatory responses, and neurotransmitter synthesis, all of which are beneficial for maintaining brain health. When paired with vitamin K2, which helps regulate calcium metabolism and supports vascular integrity, the combination ensures that calcium is properly directed to bones rather than soft tissues. This synergy not only bolsters cardiovascular health, which is crucial for maintaining optimal cerebral blood flow, but also indirectly supports cognitive function and overall brain resilience in individuals taking stimulant medications. GQ asked, Q1. How does magnesium glycinate compare to other forms of magnesium in mitigating neuromuscular side effects from psychostimulants? Q2. What clinical evidence is available linking zinc supplementation with improved dopamine regulation in patients using Concerta? Q3. Can you elaborate on how NAC's effects on glutamate modulation contribute to its neuroprotective benefits? Q4. Are there particular dosing strategies for vitamin D3 and K2 that optimize their synergistic effects on brain and cardiovascular health when using stimulant medications? Q1. How does magnesium glycinate compare to other forms of magnesium in mitigating neuromuscular side effects from psychostimulants? Magnesium glycinate is a chelated form where magnesium is bound to glycine, a combination that enhances absorption and minimizes gastrointestinal discomfort compared to forms such as magnesium oxide or citrate. This high bioavailability means that more magnesium is delivered effectively to help regulate neuromuscular activity. Additionally, glycine itself has calming properties that may contribute to reducing muscle tension and cramping, making magnesium glycinate particularly effective in addressing stimulant-induced neuromuscular side effects. Q2. What clinical evidence is available linking zinc supplementation with improved dopamine regulation in patients using Concerta? Clinical studies, especially in pediatric ADHD populations, have demonstrated that zinc plays a critical role in dopamine synthesis and receptor regulation. Randomized controlled trials have observed that zinc supplementation can enhance the effectiveness of stimulant medications like Concerta by correcting zinc deficiencies, which are often linked to impaired dopamine metabolism. Although direct research in adult populations is less extensive, the underlying biochemical pathways suggest that adequate zinc levels support dopamine regulation, thereby potentially improving attention and behavioral outcomes in those using stimulants. Q3. Can you elaborate on how NAC's effects on glutamate modulation contribute to its neuroprotective benefits? N-acetylcysteine, NAC, modulates glutamate levels by enhancing the function of the cysteine glutamate antiporter. This process facilitates the removal of excess extracellular glutamate, thereby preventing excitotoxicity, a condition where too much glutamate overactivates receptors leading to neuronal injury. Moreover, NAC replenishes glutathione, the body's principal antioxidant, which further protects neurons from oxidative stress and inflammation. This dual action of balancing glutamate and boosting antioxidant defenses contributes significantly to its neuroprotective benefits, particularly in environments where stimulant use may exacerbate oxidative and excitatory stress. Q4. Are there particular dosing strategies for vitamin D3 and K2 that optimize their synergistic effects on brain and cardiovascular health when using stimulant medications? A commonly recommended strategy is to use vitamin D3 at around 5000 IU daily paired with vitamin K2 in the range of 100 to 200 micrograms per day. Vitamin D3 is pivotal for supporting immune function, mood regulation, and overall brain health, while vitamin K2 helps direct calcium to the bones rather than soft tissues, reducing the risk of vascular calcification and supporting cardiovascular health. This combination is believed to work synergistically, but optimal dosing may vary based on individual blood levels and overall health. Regular monitoring and adjustments based on serum vitamin D levels are advised for maintaining the best balance and maximizing the benefits when using stimulant medications.